everyone. This is Henny Espinosa with Just Wish Foundation. Today we are joined by Paul Hepfer, CEO of Project Open Hand, a nonprofit organization that provides nutritious meals with love to the sick and the elderly in our community. Thanks so much for joining us on Just Wish Foundation, Paul.
Thank you. Thanks for having us.
So, Paul, tell us a little bit about the history of Project Open Hand and how this was founded by a San Francisco grandmother and also a food service worker.
Yeah, it's really a great story and one I love to tell because it's so quintessential San Francisco, and I think it really speaks to what community members can do, even if they are retired or in their older years in life, as our founder was, Ruth Brinker, nearly 40 years ago. And in fact, her story is so compelling that a documentary film producer produced a short documentary about her called The Ruth Brinker Story, which is now on YouTube, on the YouTube channel, and it played in 12 different international film festivals.
Wow.
Because it's such an interesting story. So just quickly, and the documentary does a much better job telling her story than I can, but Ruth Brinker was a retired food service worker, 63 years old, in 1985, when she knew that there were some young men that she knew that were suffering from an illness that nobody knew what this was. And this was the initial outbreak of HIV/AIDS in our country. The community knew that it was something happening to young gay men in particularly, and so there was a lot of fear and stigma around that. It was even called the gay cancer by some people slanderously, and there was fear about even being in the same room with someone with this illness at the time. But Ruth Brinker knew that these folks were sick and they needed food. And so what she did was cooked them food out of her own kitchen here in San Francisco and delivered meals to people who could barely even get up out of the bed to eat or to open the door to let her in. So this work of hers continued in the early years of HIV/AIDS, and people came to her and said, "How can we help? We want to help you do this." And over the next couple of years, there was a church that made a kitchen available to her so she could produce more meals. And then there was a small kitchen built for her on 17th Street. And fast forward many years later, we now have a fully commercial kitchen functioning where we produce nearly 3,000 meals a day out of the Tenderloin in San Francisco. And her work has led to what we are able to produce today.
Wow. So I understand that as part of your expansion in your services, you now have medically tailored food, right?
Correct.
To help clients recover from illnesses. So tell us
Correct.
about that and why that is so important.
Yeah, so in the early days, like I mentioned, we served only people with HIV and AIDS, and it was pretty clear to medical providers and the community that this high quality nutrition we were providing could be beneficial to people with other illnesses like diabetes, heart disease, cancer, COPD, chronic obstructive pulmonary disease, kidney disease, and other types of illnesses. And the community, really requested Project Open Hand that we expand what we do to include people with those illnesses. And so over the years, we not only did that, but we really put more time and effort into refining our meals, and they are called medically tailored meals now. They meet a very strict nutrition guideline that's based on science and peer-reviewed research. Like our Heart Healthy meal has much less sodium, but you want it to taste good so people will eat it. Also, if you're dealing with heart disease, you have very restrictive dietary needs. So our registered dietitians work with our chefs to create recipes and menus that are not only meet the science-based nutrition standards, but also taste really good and people want to eat them too. And part of the medically tailored meal element that sometimes people forget is that it's not just the meal, it's the nutrition counseling that comes along with it that we provide via a registered dietitian during the course of the time that they receive this service.
Wow. So it's really helping them heal. It's not just nourishing them, it's really helping them heal too from what they're
Ab-
going through. Yeah.
Absolutely. If they were recently in the hospital and they're dealing with a complication related to diabetes or heart disease, this will help them heal from that. If they have diabetes that's been uncontrolled, we know that that can lead to heart disease.
Hmm.
So these types of meals can help prevent or even delay
Yeah.
developing a secondary chronic health condition. So that's why we say they're meals with love and meals that heal.
Yeah, yeah, that's great. That's great. So tell us about your partnership with with UCSF or University of California, San Francisco on the scientific studies that track data on the health benefits associated with food as medicine.
Yeah, so we've worked with UCSF on a number of different research projects over the years. One of the first ones was, I think, almost 10 years ago, where we looked at people with HIV that were receiving our medically tailored meals, and the research showed that they had a higher rates of maintaining medication compliance. So they were able to take their medications at the rate that they were required to by their physician, related to receiving medically tailored meals, which is really important to have the right type of medication for a number of chronic illnesses, including HIV. Some of the other research we've done has been related to diabetes, lowering your A1C scores, improving heart disease, compliance and results associated to that. Some of the other research has shown reduced readmissions into hospitalizations into the hospital if you've been on our program. And then even outside of our research with UCSF, we've worked with Kaiser, we've worked with Stanford, we've worked with some other research institutions with our partners in the East Coast. So the data has been really sound, to work with research institutions and hospitals like UCSF. And that really gives us more credibility to talk about this intervention when we're talking to healthcare payers and policymakers that, this type of nutrition, not just food, but this type of nutrition in particular, can actually reduce healthcare costs and help people live, a much healthier life with higher quality of living.
Great, great. And you also have partnered with the Zuckerberg San Francisco General Hospital, right?
Yes.
And this is focused on the growing problem of food insecurity. So tell us about that.
Yeah, we definitely have. And we like to, working with Zuckerberg Hospital and other hospitals, we really like to use the word nutrition security or nutrition insecurity versus just food insecurity, because there's a lot of food out there and a lot of it's not good food, and it's not good for people that are dealing with certain health issues. So working with hospitals, we've been able to really champion nutrition insecurity and help people that are dealing with chronic health issues release from the hospital, receive our medically tailored meals and groceries, and learn how to access healthy produce that can help them maintain a healthier life.
Yes, of course, of course. And part of your service is also helping adults with disabilities, right? Tell us
Correct.
about your food program that caters to them.
Yeah, at our headquarters at 730 Polk Street, we actually have a hot lunch site, funded by the Department of Aging Services here in San Francisco, really targeted for adults living with developmental disabilities. So they can actually come in and get a hot lunch here in the Tenderloin. They can sit down and eat it. They can take it away and, take away and have this healthy food that, although it's not a medically tailored meal in the sense that it's on a delivered service, it's still the same menu and still meets the same science guidelines related to a heart healthy, what we call the heart healthy meal for people with heart disease and diabetes. And it's open to anyone here in the city to come in and have those lunches.
So let's talk more about your initiative to really make sure that people really have access to your services and that you bring the services to them. So tell us about your Getting to Zero initiative and your outreach in various neighborhoods.
Yeah. So, During the pandemic, when we closed our facility to volunteers and clients not being able to come in and pick up groceries, we actually have a grocery store here at 730 Polk Street where people can come in and pick up groceries, but we had to close that down and really reduce. It wasn't shut down completely, but we had to greatly reduce the number of people in the space. So we started delivering more groceries and medically tailored meals, and we've kept up doing that because some people aren't able to come out to our center to pick up the meals and groceries. But we also have produce mobiles at locations that, if you go to our website, you can see where they're at on a regular basis. So if you're a client of ours signed up for our service, which again, you can look on the website or ask your medical provider how to access our service, we will have our produce mobile there distributing healthy groceries for you, and you can come pick up, and you know that we're going to be there at a particular time, which has really helped people who couldn't come to our facility. It's a lot to carry. First of all, it's a lot to get on public transportation, and it's just hard, carrying that much
the
food
hills
around
of
with
San
you.
Francisco
And the hills and a lot to contend with there. So definitely the increased access through our produce vans have really been an important addition to clients here in the city.
But Paul, how can people walk in and get food? Like, how do they avail of the services besides reaching out to their medical providers?
So if you're an older adult in San Francisco, you can go to any of the senior meal sites, which are really the information's very accessible, either on our website or the Department of Aging Service website, or any of the senior centers you know of probably have a lunch program there, and we are one of the main providers at those meal sites. So there's that's one avenue. The other avenue is if you do have a chronic health issue like heart disease, diabetes, HIV, cancer, end-stage renal disease, chronic kidney disease, and you're a Medi-Cal beneficiary. That means you have managed care probably through San Francisco Family Health Plan. You can talk to your medical provider, and they can make a referral directly to the health plan, and we will receive that referral, and we will call you and get you set up for either meal delivery, or you could come in and pick up your meals too. It's a pretty quick process, but like I said, it all starts with your healthcare provider, meaning your physician or your nurse or your social worker, whoever you're working with.
Great. And, with the close to 4 decades that you guys have been around, could you just give us an idea of how many clients have you guys helped?
Yeah,
There's
certain fast food restaurants that put on their sign over 1 billion hamburgers served over the years. We do about 1 million meals a year.
Wow.
And we've been doing this, like you said, for close to 40 years. And on any annual basis, there's, between 5,000 and 8,000 people that receive our services here in San Francisco, Alameda County. We've been there over 30 years. Also, we have a grocery center in downtown Oakland, and there's a few other places where they don't have access to our type of meals, like our renal meal. We provide some of those to Santa Clara County. We provide some meals to Richmond, which is, just outside of Alameda County. So, it's hundreds of thousands of people over the last 40 years have received our meals. And I don't know if we've done 1 billion, but we've done an awful lot.
Wow, that's so great. And with the community support, with your community partners, Paul, how do you hope to expand your services? What are your plans?
Yeah, the volunteers, as many of our board members over the last 40 years have said, have been the heart and soul of the organization for so long. We have thousands of volunteers that come in and help repack grocery staples that we can help distribute to clients. We have, tens of thousands of donors that give anything from, $5 to tens of thousands of dollars. And many people sign up for what we call the Supper Club. It's a program where you can make automatic donations, without having to do anything. You can, if you want to give $5 a month, you can sign up for the Supper Club. If you want to give $500,000 a month, we'd be glad to take that too. And that's a really easy way for you to contribute and know that you're helping us provide medically tailored meals to people who need them.
Yeah, that's great, because it's like in any way, in any capacity, whatever the person or your volunteers can give, you allow them to be part of this movement of good that your founder started.
That's right.
And that kind of acceptance and welcoming, spirit in the community that continues to live on to this day. And we at Just Wish Foundation, we're just so glad that we met you guys. And we hope we can continue helping you guys, because food is such a basic need, but it's such an important, it's the primary need that we need to address. And it's not just food that you guys provide, but nutritious meals and an opportunity to really heal from whatever challenges they're going through with their health. So we applaud you, Paul. We applaud Project Open Hand, and we just realize and honor you guys with what you guys do in the community, the impact that you guys have in the community, and more power to you guys. So thank you for all that you do.
Well, thank you, Henny. And I think, the support of your foundation, like many other folks, we're all in this together. And,
totally.
we're fulfilling Ruth Brinker's legacy.
Yeah.
She brought people along with her that still remember her to this day. And I feel like, I'm just a part of that movement, like you are now too, and like anyone else is that contributes to us in any way that they can.
Thank you so much, Paul. Talk soon. Thank you.
Thank you. Thanks.